My name is Rosamund Adukisi Deborah. I am the WHO Brief Life Ambassador, and I'm the founder and executive director of the Ella Roberta Family Foundation. This was set up after my late daughter died from a severe asthma attack. Ella was very similar to a lot of youngsters in London. We have 250,000 children between the ages of 5 to 19 who have asthma. Luckily, she wasn't born with asthma, but she suddenly became ill 3 months short of her seventh birthday in October 2010. Initially, we didn't think it was asthma, although she was having hypoxic seizures. But I think after being in a coma in 2010, the tests in 2011 showed she had life threatening asthma. Ella had her first inquest in September 2014. The conclusion there was obviously she died from respiratory failure, but they also found that her triggers, which were not known during her lifetime, was due to something in the air. Subsequently, we investigated where we lived, and something in the air ended up being air pollution, which was from the South Circular. The South Circular is one of the busiest roads in the UK. It has hundreds and thousands of lorries, cars, buses, everything going through every day. And what the coroner concluded that if it wasn't for the illegal levels of air pollution on the South Circular, not only would Ella not have got asthma in the first place, she wouldn't have died on that fatal night. Because on the 14th of February 2013, air pollution at that time was the highest it had ever been. Since then, actually, on my journey investigating air pollution and the impact it actually had on my daughter, I actually then learned about the impact of air pollution on millions of children worldwide. I have to admit that wasn't known to me. The environmental cause of it. The coroner concluded in the second inquest, he had three recommendations really, and they could apply to any government everywhere. The first one was that WHO limits should be a minimum requirement. And his message was very clear to the UK government, but that could be applied everywhere. Unless you clean up your air, children like Ella, and what he meant by that is children who live near busy roads, they will continue to die. And it's a very sad case that in the UK, especially in London, the number of children who die from asthma remains unchanged between 8 to 12. Luckily, during COVID, probably the only positive thing about COVID, during the first lockdown, for the first time in the UK, no child died from asthma. We noticed that NOx went down at least 50%. Unfortunately, PM2.5 remained constant, but that alone meant no child died. The second recommendation, and the coroner was very clear about it, when it came to general knowledge amongst the public, it was incredibly low. So there were brilliant schemes, but this wasn't known. And the other thing he concluded was that monitoring is woeful. And that's something I tend to look at every now and then who is monitoring air pollution worldwide, and it's not a pretty picture. There needs to be more monitoring, and what the coroner advised as well is public authorities need to let their people know what they are monitoring rather than just put in schemes. And the third one, recommendation, and probably one of the most important one, was everyone in health. The coroner felt undergraduate, postgraduate, everybody involved in health needed to know about air pollution because during Ella's lifetime, we never got to the bottom of her triggers. And now that we know, according to WHO, between 7 and 9 million people die worldwide, this is something everybody in health, policy, finance, everyone needs to get to grips with this. We call this a natural health crisis rather than a climate crisis. Why do I say a health crisis? Air pollution impacts every single organ in the body. So we know cardiovascular, we know strokes. 20% of strokes are down to air pollution. We know some types of cancers like lung cancer. 30% of lung cancer now in the UK is down to air pollution. It's been linked to suicide, depression, low sperm count, and the latest one is cognitive decline, which in other words is dementia. So they have found black carbon on patients' brain, and not just on patients' brains. We now know in pregnant women they found black carbon in the placenta. So what we know about air pollution is that it impacts us from the beginning, from the cradle, all the way to the grave. And it is important that public authorities, they have, governments have a duty to their citizens, and they must clean up the air. Look, it's been documented now, the impact of air pollution, and we keep on mentioning the figure 7 million again and again. It's now time for action, I'm afraid. I think I am going to call upon governments, public authorities everywhere. The coroner was very clear. We need to monitor it. And also, we need to lower emissions. We all know that the black carbon comes from fossil fuel, it comes from wood burning, and in some countries, we know it comes from coal. We know where all the sources of air pollution are. This is no hidden secret. What has held this back is up until Ella, and she still remains the only person to have air pollution on her death certificate. And I have inquired with scientists about this. And this is because, as we know, it is mixed in with gases and things like that. So it's not clear cut. But we don't really need any more deaths. The evidence, there's over 70,000 studies linking air pollution to health. We already know this. So I think governments need to run public health campaigns. They need to bring in schemes. I don't think it's a case of just bringing in schemes. As the coroner said, there is a low level. So it's up to governments to do public health campaigns, very similar to smoking. Because what we generally say in London, studies have been done, and air pollution is equivalent in hotspots, similar to passive smoking, 10 to 15 cigarettes daily. Now, that should serve as a warning. We all know the impact of tobacco on health, and air pollution is no different. Unfortunately, I must say, the government, and I mean the UK government, did not take this seriously enough. They brought in an Environment Act, and what still pains me till now is the worst pollutant, the one that impacts health, particulate matter, they left it out of the Environment Act. And that's why now in the UK, we are really campaigning for Ella's Law. And Ella's Law will be significant if it passes. It has already passed the Houses of Lords, but Ella's Law is unique in that it looks at both outdoor air and indoor air as well, because 90% of our time, and COVID was a reminder, we spend it indoors, and we need to be concerned about what we're breathing indoors. A lot of people don't feel they have control about outdoor air, but they can certainly do something about indoor air. So please support Ella's Law. Thank you.